Good evening and welcome to GBS CIDP on the Couch, presented by It's a Patient Thing. Pages participating in tonight's stream include It's a Patient Thing, Guillain-Barré Syndrome Survivors, Guillain-Barré Syndrome Fighters UK, Holly after GBS, GBS CIDP Awareness, and GBS CIDP on the Couch. We encourage you to like each and every one of our participating pages. Tonight's subjects include gabapentin and Social Security disability benefits. Joining tonight's show, Tammy De La Cruz with CIDP and Jacob Lowry with GBS. Ladies and gentlemen, GBS CIDP on the Couch.
Good evening and welcome to GBS CIDP on the Couch. It is December the 9th, 2018. We are streaming on each of those pages, so we appreciate it if you would like each of those pages that were just mentioned. We will be discussing gabapentin and Social Security disability benefits. Tonight we have two panelists, myself as well as Tammy De La Cruz. We are going to get started with gabapentin. So gabapentin is a medication most people with GBS and CIDP have heard of, if not taken. Tonight, let's dig a little deeper into this medication. Gabapentin comes in three forms: a capsule, a tablet, and an oral liquid, generally taken with an 8-ounce glass of water, with or without food, 3 times a day. Gabapentin is an anti-epileptic medication that was originally cleared by the FDA in 1994. Also approved for, and I'm going to mess up this word, post-therapeutic neuralgia, I think. It was approved for that for adults in 2002. I'm not going to repeat what that word is, but what it is pain due to shingles. Those are the two official FDA indications for gabapentin. In my research, the FDA approved uses of gabapentin. I saw no mention of Guillain-Barré or CIDP. As I continue in research, I found that 83% of the cases gabapentin is prescribed to treat are not approved indications by the FDA. The term off-label is used for these cases. As I researched about this medication, I found multiple references that said something to the effect of, the reason why gabapentin works is unknown. When I chose this subject a couple weeks ago, I was hoping that we could discuss why gabapentin works, what it does, how it helps, all of those different things. And unfortunately, I guess nobody really knows. As the research continued, I found that a lot of medications are prescribed off-label. There have been multiple lawsuits of patients from this issue of they're having a side effect, an adverse reaction to a medication that was prescribed for something that the FDA didn't clear it for. And I found that in most every case that was mentioned, the patient never won. The doctor always won. That the FDA is not in practice of regulating what doctors are allowed to prescribe. Once the medication is approved, it is then they can use it for all kinds of different things. But in one case with gabapentin specifically, in 2003, a federal jury evaluated whether Pfizer, I think is how you pronounce it, it's the company that owns gabapentin. Pfizer Incorporated violated anti-racketeering laws in promoting its epilepsy drug, gabapentin, also known as Neurontin, from for unapproved uses. The case stemmed from a claim that Kaiser Foundation Health Plan, from Kaiser Foundation Health Plan, that it was misled into believing gabapentin was effective for off-label treatment of migraines, bipolar disorder, and other conditions. Pfizer countered that Kaiser physicians still recommended gabapentin for those uses even after Kaiser sued Pfizer. Just a side comment: why can't people come up with normal names for companies? The court ruled against Pfizer in September of 2009. Pfizer finalized the settlement with the U.S. Department of Justice for a record-shattering $2.3 billion. A subject that has come up recently is that gabapentin is the new opioid, which, talking to patients and doctors, none have understood why. I found something interesting in my research that has to do with this part of the conversation. Gabapentin is one of two medications used in the ProMeta treatment protocol for methamphetamine, cocaine, and alcohol addiction. Gabapentin at a dosage of 1,200 milligrams at bedtime for 40 to 60 days is reported to have some potential for reducing the cravings and withdrawal symptoms associated with discontinuation of methamphetamine use. It also helps those addicted to prescribed pain medications and reduces withdrawal syndrome. FDA approval involves a company must submit clinical data and other information to the FDA for review. The company must show that the drug is safe and effective for its intended uses. This is both time-consuming and costly. While the FDA-approved indications don't involve GBS or CIDP, there are research studies out there to prove that it can be effective in treating nerve pain due to GBS and CIDP. However, in my research, the studies are quite small into the gabapentin for GBS and CIDP. One of them only involved 36 people. The long story short, gabapentin has been shown effective for GBS and CIDP in clinical trials. However, its use for our conditions is not FDA approved. So discuss the medication carefully with your doctor. Now, of course, this isn't just my opinion and what I want to talk about each and every week. We try to bring in a panel of four usually, but lately it's just been me and Tammy. So bring Tammy in here and then get her opinion on gabapentin.
Good evening.
I only see half your face, by the way.
Okay. Is that better?
Yep, that's better.
Okay. I'm trying to get the right angle here. Um,
Now
so
I
if
can
you
only
want,
see it again. There we go.
there we go. I'm actually taking gabapentin, and I take, oh my gosh, gabapentin brain here. Um, 800 milligrams 3 times a day. So I don't know how it works either. Um, I take it for the CIDP. My mother takes it for peripheral neuropathy, and my brother-in-law used to take it for neuropathy that he had. But obviously, as you said, we don't know why it works.
Right.
Um,
I'm not complaining that it works.
no, I'm not either. And but there are some things you do have to look out for when you're taking it, though. Um,
Right.
there it does. What I found out was actually for us ladies, there can treat hot flashes. But
Interesting.
gabapentin does have increased suicide rate.
Heard that too.
Yeah. It occurs in about 1 in 500 people that are taking the medication, which 1 in 500